Rahim. In the today's lecture, I'm going to discuss about the clinical finding of Mycobacterium tuberculosis. In the previous two lectures, I have discussed the pathogenesis of the Mycobacterium tuberculosis. In the clinical finding, you should observe fever, fatigue, night sweats, weight loss. Now, what is pulmonary tuberculosis? Actually, infection of the lung. It is the type of tuberculosis in which the organism is present in the lung. It is called pulmonary tuberculosis. Due to pulmonary tuberculosis, you should note cough and hemoptysis. What is hemoptysis? Hemoptysis is the coughing of blood or blood-stained mucus from the bronchi, larynx, trachea, or lungs. In other words, it is the airway bleeding. Now, uh, another important terminology: extrapulmonary tuberculosis. What is extrapulmonary tuberculosis? It is the type of tuberculosis that's in which the tubercle bacillus spread to other part of the body, and about 10% cases it can spread to the bone marrow, and in which it is called bone tuberculosis. And bone tuberculosis, it affects the spine, the long bone, and the joint. In the US, only 3% of all the tuberculosis bacillus causes affect the musculoskeletal system. A common form of spinal bone TB is also known as Port's disease. You should note for MCQs: what is Port's disease? Port's disease is a type of disease in which the Mycobacterium tuberculosis infect the bones. Now, another terminology: what is Scrofula? Scrofula is a condition in which the bacteria that causes the tuberculosis. Um, causes the tuberculosis and causes the tuberculosis, and the symptoms are outside the lungs. Inflamed and irritating lymph node in the neck. It is also called cervical tubercle lymphadenitis. What does it mean? Actually, cervical mean neck, and lymphadenitis mean inflammation in the lymph node, which are part of the body immune system. Now, very important terminologies we are going to discuss. Historically, the Scrofula was called the king's evil. The doctor thought that the only way to cure the disease was to touched by a member of the royal family. Its scrofula is also characterized by fever, malaise, which is the general feeling of unwell, night sweats, unexplained weight loss, etc. Nowadays, the doctor knows about it. What is scrofula? Now, disseminated TB. What is disseminated TB? Disseminated tuberculosis, a type of tuberculosis, occur when the organism reaches to the bloodstream, and to the bloodstream, and drain from the bloodstream again to the lungs. Disseminated tuberculosis occur in the primary tuberculosis as well as in the secondary tuberculosis. One type of disseminated tuberculosis is malarial tuberculosis. Malarial tuberculosis got its name in 1700 from John Jacob Mengele, based on how it appeared on the autopsy finding. Malarial pulmonary disease occur when organism draining through lymphatics enter into the blood and circulate back to the lungs. In this condition, multiple small thin granuloma 2 to 4 millimeter and 2 to 4 meter in size scatter throughout the lung parenchyma. Since a millet seed is about size, the condition become known as malarial TB. If it's left untreated, it kills the patient in days or few weeks. This is millet seeds. When you observe the lungs of the patient, it look like that millet seed are someone has put the millet seed in the lung. Therefore, it's called malarial tuberculosis. It is difficult to diagnose in older age, therefore, it is also called cryptic tuberculosis. Now, what is renal tuberculosis? Renal tuberculosis is the hematogenous seeding of Mycobacterium and the glomerular and peritubular capillary bed from pulmonary site of primary infection. Small granuloma form in the cortex. Why? Because this bacteria love to grow in oxygen and this region is rich in oxygen. Therefore, bacteria proliferate and it causes renal tuberculosis. Sometimes the bacteria travel to the meninges and it causes the meningiotuberculosis. It is very dangerous and the treatment is very difficult and sometimes it need always it need the ICU for in intensive care unit for the patient to treat well. Otherwise, it will kill or it will cause the death of the patient. Oropharyngeal tuberculosis. It is actually the ulcerative conditions that are caused by the Mycobacterium tuberculosis. And the next lecture we will discuss that how the Mycobacterium tuberculosis reactivate and what are the risk factors that are involved in the reactivation of the Mycobacterium tuberculosis.